My name is Daniele Olveczky. I'm a physician and a clinician at Beth Israel Deaconess Medical Center. I'm a geriatrician, a hospitalist, and at Harvard Medical School, I'm co-director of the Health Equity and Anti-Racism theme with Dr. Rose Molina. As part of our curriculum, we're tasked with creating a course on microaggressions in the clinical learning environment because they can be so detrimental to the therapeutic relationship between patients and physicians. So when we first did this course, now about 5 years ago, microaggressions was a new hot topic, and there hadn't been so much of it in literature. But in the past 5 years, there's been so much. We're always thinking, how can we innovate in this space and still push our students to learn even more competencies? So I wanted to teach a class on how responding to microaggressions can really be empowering to us, give us agency, and really help to mitigate moral distress, as well as enable us to demonstrate leadership competencies. So I basically went to DALL-E and I asked it, please create an image summarizing how responding to microaggressions in the clinical learning environment can empower us to have agency and can combat moral distress. And here are the images it created. What's really nice, what I really liked about this was that it is a diverse group of health professionals. They're showing you the brain and the impact of microaggressions that it can have on one's brain and one's sense of well-being. And then here they are. They're more in a nice cohesive group. Everyone's smiling. And the whole idea is this sense of well-being when we are much more inclusive and try to really address what can be very awkward moments in our clinical learning environment. Also, for health equity and anti-racism, we're very, very interested in assessment. How do we assess and ensure that our students are really acquiring the skills that we think is essential for future physicians? And so one question I had for ChatGPT, we're given the golden opportunity, to be able to add 2 questions to the student performance evaluation. At least it's being evaluated as a possibility. So here I'm using ChatGPT more as a crowdsourcing. What are my blind spots coming into this when I'm creating these questions? So I told it, I'm the director of the Health Equity and Anti-Racism curriculum at a medical school, and we want to add 2 questions to the performance evaluations. And I asked it, which 2 questions should we add to the student performance evaluation to assess their skills in this arena? What I liked about this is that it generates it for you demonstration. So question, how effectively did they identify and address social determinants of health and health disparities? And it also tells you why it picked this question. And then it asks for that higher level as well, the application of these principles in the clinical settings. And it's saying, please provide examples. And it also says why it chose this question. So again, it's making sure that I'm not missing any, blind spots, how they want to encourage evaluators to provide specific examples. And that's also beautiful because we know that medical student evaluations can be very biased. And so it's asking us to ask evaluators for examples. But, when we are going to use this now, we're going to have to curate this into pre-entrustable, and then emerging and then entrustable, and potentially give examples for evaluators to choose from. So it gives you a nice framework. You can't accept it as it is, but it really gives you a nice framework of how to start to assess our students. So I have 4 takeaways when it comes to using generative AI, ChatGPT, and other things like DALL-E. I think number 1, be extremely specific in the prompt. If you look at the prompt, I said, what 2 questions and what do I want to do with those questions to assess their skills, clinical skills. So almost every word you put in the prompt is like high real estate. It's got to count, and you want to make sure you're giving it the best prompt possible because that's going to determine what you get back. The second thing, it's really important. It's like crowdsourcing and enabling you to see, what's the general consensus out there as to what, and it also helps you. The third thing I'd say about what are my blind spots. You do the crowdsourcing, then you find your blind spots. And then the last thing I think is maybe more, the most important thing is that you can never really use it blindly. You've got to carefully curate the content. And I'll go through this, for example. So It says here social determinants of health. That's kind of an older term. We would more say structural determinants of health or health equity. We may not use health disparities, we'd use health inequities. So you've got to be really careful about the wording it's giving you, and you would want to make sure that what you're using is what you know is the most current or up to date thinking about the topic.